Hi, Kurt MUNOZ here, physical therapist with Balance Physical Therapy. Here to show you one technique to help with knee pain, especially pain in the tibiofemoral joint, which is our primary joint at our knee, especially if we have arthritis, a condition that can decrease some of the space for the knee. So what we're going to do here is a technique called tibiofemoral distraction. And what we do is we put the knee in an open packed or really comfortable loose packed position where we don't have a lot of congruency or pressure on the joint, which is about 25 degrees in the knee. And then what we're going to do is we're going to come up really high on the tibia, which is the bottom part of the knee joint, and we're going to give it a little distraction. Now by having the femur, the top part of the joint, just resting on this foam pad here, it helps to just stabilize the top portion, so I can just gently give a little distraction or stretch into that joint. Now someone that has pain, especially arthritic pain because of loss of joint space, can get a lot of comfort, and we can help them to get more range of motion, tolerate exercises and activities in the clinic much more comfortably. And that's our ultimate goal, is to help them move more and move well. And so we can hold this stretch, or we can do what we call graded oscillations, where we can stretch with these little rhythmic oscillations. So similar to someone would think about traction in the back, this is just traction specific to the knee joint. And we could come in here and do about 3 rounds of 30 seconds of these oscillations to help with pain, to increase joint mobility, and ultimately help this young lady move more pain-free and get back to her day-to-day life. Another component of knee pain, or the knee joint itself, is the kneecap or the patella. The kneecap is there designed to increase the efficiency or the distance that the muscles work from the leg itself to help it be more efficient, stronger. And so if the kneecap isn't gliding as optimally as it should, it can cause some knee pain, discomfort, and ultimately decrease our range of motion and power output. So another technique we can do to help with knee pain is mobilizations at the kneecap itself. So we call these patellar mobilizations. So the kneecap should be able to move inward, we call that medially, a little bit outward. We don't worry about outward motion as much, but inward it should definitely be able to glide nice and smooth inward, and it should be able to track up and down and tilt. So we're going to work on mobilizations, especially inward on this knee here, to help with overall range of motion and function. And again, we can do about 30-second rounds of these little oscillations, and we do about 3 rounds.